Imagine entering a room, sitting across from a person you've never met, and within a few minutes, you're able to gain an understanding of their cognitive abilities. This is the essence of a mental status examination, a thorough assessment of a patient's cognitive functions which include attention, language, memory, and visuospatial perception. The examination consists of two main parts. The first is the psychiatric aspect, where we look at the patient's affect, mood, and thought processes. The second is the cognitive aspect, where we assess consciousness, awareness, language, memory, and executive abilities. The goal is to understand the patient's orientation in time and place, offering us a glimpse into their current medical condition. To illustrate this, consider the case of Mrs. Brown, a 60-year-old woman who recently began forgetting appointments and misplacing items. A mental status examination becomes crucial in determining the nature of her problem. In the examination, Mrs. Brown is asked to recount her recent illness and hospitalization dates, as well as recall specific incidents. These serve as effective tests for her memory. Her language ability and coherence of thinking are also evaluated. As she speaks, her spontaneous speech is noted for any signs of speech or language disorders. Furthermore, her reading, writing, spelling, ability to follow spoken commands, repetition of words and phrases, naming of objects and their parts, and solving simple logical problems are all put to the test. To check her visuospatial perception, she is asked to perform tasks like bisecting a line, drawing a clock, or copying figures. In this way, her language, cognition, and other higher cerebral functions are examined. The results of Mrs. Brown's mental status examination would then provide invaluable insight into her cognitive abilities. Is her forgetfulness a sign of an underlying concern, or is it a normal part of aging? Only through this comprehensive examination can we begin to understand and answer these questions. The mental status examination is a fundamental tool in the medical field. Its importance lies in its ability to provide a comprehensive understanding of a patient's cognitive abilities, which is crucial in diagnosing and managing various health conditions. It's not just about knowing what's wrong, it's about understanding the person in their entirety, their mind, and how it interacts with the world around them. From Mrs. Brown to countless others, the mental status examination remains a cornerstone in patient assessment.